So 45,000 are people whose bodies were taken to a Ministry of Health hospital, and they were taken by people who witnessed or who recognized them, and a death certificate was issued. This 45,000 excludes the tens of thousands who are still under the rubble, more so in the north, where the emergency services were targeted by the Israelis and so are now completely unable to function. And so we see pictures of dogs eating bodies of those killed in the streets. And so not only people under the rubble, people who've been killed and not reported, or their bodies have not been retrieved. When you drop 2,000-pound bombs, there's very little of the human body that is left. And so there are people who literally pulverized by these bombs. Then you have those whose chronic illnesses, once untreated, became deadly. So the kidney dialysis patients, the heart disease patients, the diabetics who were no longer able to get treatment. It doesn't take into account the women who are dying from maternal care, from obstetric injuries during delivery, because they're delivering in makeshift hospitals, they're delivering in the tents, and they're malnourished when they give birth. And so them and their babies have a higher rate of maternal mortality, of infant mortality. And then you have those who are dying of infectious diseases, of the thousands who have hepatitis at the moment, of the polio, and those who are dying not immediately from their injuries, but from the wounds that do not have access to health care to stop the infection setting in, and then eventually the infection becoming sepsis and killing them. The number is closer to 300,000.